speaker for today is Anthony Ponzio. And we will to talk about the Schwarzschild treatment and aligner therapy. He is sponsored by Dentsply Sirona. Thank you, Susan, for your support. I use Schwarzschild and I use a pre-prosthetic treatment for the aesthetic cases to have another position in the front area for my teeth and to can be minimally invasive. But now I'm very excited about the concept from Anthony. And Anthony, please start your lecture. Thank you very much.
All right, thank you for having me. Thanks for having me out. I'm very excited to be here. As mentioned, my name is Anthony Ponzio. I am a general dentist from Chicago. Oak Park is a little suburb, very cleverly named Ponzio Dental. We couldn't come up with anything better than that. I'm the clinical director of a group of dental practices. We have about 40 in our group. I've been training with Patterson Dental for many years. I've served as visiting faculty for Spear Education on the CEREC CAD/CAM side. I taught at a dental school nearby, and I've been a KOL for Dentsply Sirona for several years. What does that all mean? It means I love dental technology. I love introducing it to dentists. I like sharing things I've learned. I tend to geek out on it quite a bit. That last presentation was beautiful. That was really some incredible work. So it's really fun to be with a bunch of like-minded dentists who really want the best for their patients. So I'm honored that Alina and Dentsply Sirona invited me out to speak to all of you and just kind of show you what SureSmile has done in my practice, how I've incorporated it, how I've used it for setting up cosmetic cases, or sometimes just having it be the definitive treatment for my patients. I laughed at this meme before I put it in because I was thinking about the last couple of years and how crazy it's been. And this one just kind of gave me a good chuckle because it is true. And I think people don't realize how stressful and challenging dentistry can be. While it's also amazing for all of us, sometimes people, patients, others don't really realize kind of the grind that we go through. And so I'm always using technology to find ways to really keep my enjoyment up and find new opportunities for my patients. Most importantly, I'm a proud father of 3 boys. These 3 are a handful. They're a good time. We're really into sports. My oldest is 16. Then I have a 14 and 10-year-old. But we are a big sports family, so you may hear me throw in some sports references periodically. So I apologize if you're not into sports. Just tends to be the way I speak. So I got into dentistry because of this guy, and I'm going to give you a little background because it kind of leads me to where I'm at and why I do what I do and how I utilize some of this technology to really provide for my patients. So my father was a dentist. He graduated in 1979 from Loyola University in Chicago. And he practiced until I was actually a junior in dental school. He had passed away. So, but my father, interestingly enough, was terrified of sitting in the dental chair. He had an uncle who was a very much an old school dentist from the 40s and 50s. And his uncle believed that he shouldn't waste money on anesthetic for the family. So sit down, take it, we're going to get through this procedure. And so one of the funnier stories was I was in dental school. I was a junior or sophomore, and we were able to bring in our first patient. And so I turned to my dad all excited and said, "Oh, you want to be my first patient? This is great." Kind of smiled, looked at me and said, "You're not touching me till you know what you're doing." But that was kind of his mindset in dentistry. And it really built the way he practiced, which he then imparted to me. And so in that mindset was, I want to make sure that I can make people comfortable because I know how uncomfortable I am in the chair. And so he was able to focus on what do patients want? What are they looking for? And he was doing this long before we had Yelp and Facebook and Google reviews that would tell us exactly how patients felt. And as we all know, sometimes this is really good. Sometimes this is terrible. We might not want to hear what these patients have to say, but they're going to tell us anyways. In those days, he had to just figure it out. He had to understand from the patient point of view, what's my expectation? What will it take for me to go forward? As we just heard, dental photography is huge, right? We want patients to say yes and to move forward. When they can see what's going on, they're more motivated. And so I tend to use photography as well to get people excited about it. So because of his kind of history in dentistry, his slogan was "We welcome cowards," which ironically is my website now, wewelcomecowards.com, which number one gives people a little bit of a laugh, but it also tries to take their guard down so they're more comfortable coming into the office. He knew how to market and have fun things for his patients and just make it an interesting time. They used to send out a newsletter every month, which you can't do because of HIPAA these days, where it would actually just say which kids came in and did not have cavities. And there'd be a big newsletter with pictures and names and everything else. But it was all built around changing the dynamic of dentistry, so our patients were excited about it as opposed to being afraid or nervous. And when you think of patients now, think of the world they're growing up in. Our patients are growing up in a world where we can go to a website like Amazon, click a button, and whatever we want will be in our house within 24 hours. A lot of times it can be there the same day. And it's funny, we're so used to it that if we order something online and it's not there in 24 hours, we assume something went wrong. That's completely changed our mindset. It's changed our patient's mindset. And there's been some repercussions, some of them good, some of them not so good. And we're in a prime position, no pun intended, to actually help our patients with that. I think a lot about what cell phones have done to us. You know, we'll go in and look something up online. You start typing it into your phone, you send up a message, and if it doesn't come back within 2 seconds, we're losing our minds. That message is going to outer space and back, and we can't believe it doesn't come back immediately. So that's the world we're growing up in. We're living in an impatient world. And so while we don't necessarily have to do things in a hurry just because people are impatient, we have to understand what that mindset means for our patients. I always find it interesting when I look at what they call the impulse buy section at the checkout counter, right? People are emotional. So you go to checkout and all of a sudden you look down and there's a candy bar, and we'll tend to grab it and throw it on the tray and buy it. Now on the way to the store, we might have said, I'm not buying any junk food. I'm going to be healthy. I'm going to take care of myself. Then we get there and all we see is candy, candy, candy. And then we tend to go ahead and get it and throw it on the line, because that's what we tend to do as consumers. Is we're very emotional. And so because we're emotional, sometimes we make irrational decisions. And sometimes we just need to make that decision now, or else once we moved on, we're on to something else. That's why companies like this have become popular, right? And this is not the only game in town, but a lot of these direct to consumer companies have popped up because somebody has either gone to their dentist and maybe their dentist said, I don't offer clear aligners. You'll have to go to an orthodontist. And then they're sitting on their couch watching commercials and they see something pop up. Or maybe they're sitting on their couch at 11 o'clock at night watching TV and they look in the mirror and they say, oh, I want to straighten my teeth. They Google it and something like this comes up where they can go ahead and just order a kit online. And I think we're in an important position to say, hey, you don't have to go that route where there's less supervision than if we were to take care of you ourselves. And what holds us back is, in general, especially in the United States, orthodontic education is basically zero. The orthodontic department is hidden in the basement of the dental school. The general dentist students are not allowed near it. Maybe you come down, you bend 1 or 2 wires, they tell you don't know what you're doing. And that basically ends your orthodontic training, and they just tell you to refer everything. And the problem with that is, from an access to care standpoint, so many patients who could benefit from orthodontic care either don't know about it because we're not identifying it and talking about it, or they won't seek it out because they don't want to take that next step. So over the years, I started using clear aligners in about 2007. And I've used a few different systems, mainly because I was trying to find ways to leverage the technology I have in my office to make the system more efficient, more predictable, and more enjoyable for my patients and myself. And so I used Invisalign for many years. I tried some other offshoots. And I kept going back to Invisalign because what I want is a very predictable, efficient system. And so that lasted for a while. Even though I had some frustrations with the company, I ultimately had to decide what's going to make my patients get the best outcomes, because that's really what my role is. It's why in these other presentations, you see things like using the rubber dam and some of these other things that maybe not everybody's doing, but it's all about increasing predictability and getting our patients the best results that they deserve. And so eventually what happened is Dentsply Sirona came up with SureSmile. Okay, so I decided to try them out because I was able to use my CEREC Prime Scan to go in and scan and send this off to the patients, send this off to SureSmile. Because I have all this technology in my office, I want to make sure that I'm able to leverage that to get my patients the best outcomes. But I was worried because for me, I've tried other systems and I was burned a little bit in that they didn't quite get me the results I wanted. And so as I dug into what SureSmile was offering, I found that SureSmile wasn't new. This wasn't someone trying to capitalize and jump in on the aligner game and say, hey, we can make a bunch of money by making aligners for our doctors. They have used technology to allow us to deliver the best care possible to our patients, but it didn't just start last night, okay? SureSmile has been in the orthodontic game for 30 years, okay? And this isn't meant to be like an infomercial. It's just to give you a little history, because I think it's important for us as dentists to know there's science behind it, to know that there is more behind it, because every lab in the country at this point seems to be developing, in the world, seems to be developing their own clear aligner system. Every big company is saying, hey, I've got clear aligners, you can get them too, okay? But back in the early 90s, SureSmile started getting involved with orthodontics, and they were built with orthodontists working with them. So because of that, they were doing things like wire bending and thinking about the outcome and thinking about mechanics and all that goes along to it. They started integrating cone beam into their process in 2008. Cone beam wasn't even really universally used at that point. Then in 2015, they released SureSmile Ortho, and then eventually 2018, the SureSmile aligners were launched. Why do I bring this up? When we look at these little clear aligners, we have to realize there's 30 years of orthodontic research and history that were put into those trays to get them to where they are today. There is a lot of science with the technicians as they're working through how our cases are going to go, giving us a more predictable result. So the reason I've switched over and really like the system is obviously the clinical history is really important to me. I want to know that they know what they're doing, that it's not someone just trying to pop some trays onto some teeth and hope they move. I get to have a lot of control over the process, as much or as little as I want. So when we have a new user who doesn't really know what they're getting into necessarily and they want to try it out, they can really lean on their technicians to go through the process. Or if you're more comfortable, you can be the one to move teeth around, change attachments, all the different things to get you the result you're looking for. You'll see I have a few cases that show some of the flexibility of kind of the one-off cases. What do we have to do there? Well, we can customize every single thing we do. And we can do it all online, which is nice. So I don't have to be tied to my office to plan these things. And then I'm also able to really just set my preferences and go. So each case is planned out the way that I would want it. And you'll see as with the patients that I show, the trays are really, really aesthetic because of the type of material that they're using. Because of the science in the trays, what we see is a lot less refinements. We see shorter treatment times, less attachments. And so that allows for a more predictable and comfortable process for our patients. The fact is, even if you tell patients, hey, this is phase one, when they see that they're going to have 14, 15, 16 aligners, in their head, that's all they need. And so as much as we can stay true to that, we want to. It's not always the case. I'm really careful with my wording with my patients to say, this is phase one. And they'll ask, how many phases do I need? I said, well, we'll see. Some patients only need one phase. Some need a second phase. Some need a third phase. It depends on how compliant you are, how your teeth respond to treatment, and what we need to do to get you the result that you and I are looking for. So again, we're turning it around so they know it's in their best interest. It's not something where treatment went wrong or something didn't go as we planned. And so when we talk about the trays, you have the ability to customize this however you want. So why do we see less attachments and more efficient treatment with SureSmile? Well, one of the things I like to do with my cases is I like to opt for the straight line approach. So instead of the scalloped approach that you've seen with a lot of systems over the years, the issue with that is you don't generate as much force onto the teeth, so you don't necessarily get the same level of movement per tray. So by going with the straight line, you're able to engage all of the embrasures and undercuts to really allow for some of the more challenging movements, because that's where the hangup is. Tipping a tooth a ½ millimeter is pretty easy. When we get into rotations and some of these other movements, we need to put as much force as we can, and we're doing it without the benefit of brackets and wires and TADs and all these things the orthodontist might be using. So when I go with the straight line approach, number one, the patients say nothing, but the trays are very comfortable. So that was a worry for me when I got into it, was they're going to hate having this straight line coming across their gum. They don't notice that the trays are very aesthetic, so there's no issue there. So I've gone with that approach for all of my cases, and I just find cases that maybe in the past with other systems would have been 23 aligners end up being 14 or 15. when I'm going through my cases, I get to choose. I can go with a complete case, which is what I do for pretty much every case. And in that world, you get unlimited refinements for up to 3 years. You get something called the V Pro that I'll show you later, and you get whitening. Or on real limited cases, you can just pay per aligner. And so I've got a case where I did that, where it really kept the cost down for my patient and myself. So I was able to get her the treatment she wanted, because if I had to pay for, a massive lab fee, I would have had to charge the patient an exorbitant amount for the limited treatment she needed. So I like the flexibility the system gives me in that regard. And so for the last 15 years, I've made it a point that when patients go through clear aligner therapy, I would always whiten their teeth. Let's face it, number one, they are an advertisement for my office. And number two, they've gone through it all. They're all excited. I want them to finish even more excited than they did when they started. Okay, so I want to give them that little pop at the end. It's funny, some patients respond really well to whitening, some do not. Either way, they feel good. They feel like something good happened when they get their teeth whitened at the end. And so this comes with each kit, where you'll get a whitening kit for that patient delivered to your office. Some other technology that they've incorporated, and I talked about how SureSmile likes to bring in technology and be creative, is something called the V Pro. It's basically high frequency vibration. And the idea behind it is it accelerates tooth movement and makes tray seating a little more efficient, and it allows better comfort for the patients. So is this necessary for every case? Not necessarily. Is it a nice value add? Yeah, I really believe so. And I'll show you a case where we were able to really use it in a cool way to help our patient get through treatment efficiently. And then finally, you're able to order your retainers. They have a full retainer system built in. So you can order them by arch. You can order for both arches. At the end of your treatment, you just scan them and send them in, or you can do it based off the final position. All right, now how do we get rolling with this? That's kind of the background on the why of SureSmile and how I got to where I am today over a history of doing orthodontics for about 15 years. And so when I look at how I incorporate this in my practice and how somebody else, if you're not doing much clear aligner therapy, how do you bring it in? I love this saying, right? If you change the way you look at things, the things you look at change. And I feel like this applies to all aspects of dentistry and really all aspects of life. I think about when if you take a course on placing implants and you go take a weekend course and then go back to your office, okay, and you start thinking differently because you're fired up. You're like, all right, I do want to get into this. All of a sudden, all those patients who have missing teeth that have been missing for 22 years, you start having the conversation with them. You might say, hey, does that bother you that you've been missing that tooth? And some of them will say, oh yeah, but it's been missing so long, I'm sure we can't do anything about it. Or yeah, no one's really brought it up. Should I think about replacing it? So those are some of the situations that you'll start to look at differently. And the same is true when it comes to invisible aligners, okay? And so how do we do it? Well, the old model that we tend to employ here for sure is the hygienist does all the work, they do the cleaning, we come in at the end. And let's face it, the patient at that point is a little nervous for us to come in. We sneak in behind the room, we come over their shoulder, and all they're thinking to themselves is, please, please tell me I don't have a cavity. Okay, tell me I don't need anything. So that's a tough place then to reverse and get them excited about something else. However, as they've spent 45 minutes with our hygienists or our assistants or whoever's in the room, they're having a pleasant experience. It's a time for them to open that dialogue. So everything with this begins with the team and having the team really engaged in the process. And the more that they are, the more patients can be made aware. Because the biggest thing we're missing when it comes to clear aligners in our offices is that we don't have awareness of the patients that they might be a candidate for it, that we offer it, that it might even exist. A lot of patients will say, I'm too old for it. And they'll be 40 years old. And I always joke with them because I'm like, well, that's younger than me. So now I'm offended. Patients come in with things like this. It's easy, right? A patient comes in on the top one. What are you here for today? Or what can I help you with? Well, you don't have to be a rocket scientist to figure out they don't like their chipped teeth. Patient on the bottom, right? They'll tell you, I got something growing out of my gum tissue here. I got all these broken teeth. I can't chew. Those are very easy cases as far as how we talk to the patients about what's going on. Not necessarily easy to fix or execute, but at least the dialogue is there and the patient's very aware of what's going on. But think of how often these patients come in. And they come in and get their teeth cleaned and they all say the same thing. I always build up a lot of plaque down there. Or I don't like the way my teeth look. Can I get veneers? Right? And when you look at something like this, I wouldn't want to do those veneers. I don't know if any of you would. You're all probably much more talented than I am. Maybe you could take that on, but in my world, that's not a very fun case to try and restore. But that conversation, that should be a trigger for our team to say, yeah, you always build up plaque there. Well, it's hard to brush. A toothbrush doesn't necessarily fit in that spot as well. And now the conversation's open. What are my options? Think about cases like this when we think about a cosmetic dental consult. This patient comes in, they've had these crowns for 20 years. I don't like the way my crowns look. I want to redo them. The young dentist in me, when I was first out of school, would have had this big ego and said, well, I'll take them off. I can make way better crowns. And I guess what I would do, put 2 new crowns in that would look exactly the same, right? Or we'd look at them from the occlusal and say, the only way to fix that is to put 4 crowns or 6 crowns or 8 crowns or whatever it might be. And all that would happen is you'd have a whole bunch of crowns with some of them being extremely thick. You'd be reducing so much tooth structure, right? We talked earlier about preservation of tooth structure. We're destroying tooth structure when we try to restore teeth that are in this type of a position. So when we start thinking about getting the teeth into a better position, it's not just that they'll look better and easier to clean, it also allows us to be more efficient and more conservative in our dentistry. A friend of mine, Dr. Shalid Chaz, is saying that when he and I have taught together, he says that orthodontics is the full mouth reconstruction of enamel. And I love that saying because it's a really clever way to look at things in that you're rebuilding their mouth with their own enamel without having to use ceramics and file down tooth structure. And when you start to think of it that way, you'll start to look at your cases a little bit differently. And so SureSmile does a good job of giving you a basic guideline for what you should and shouldn't do. When you go in to log in for a case, this is all available. But I want to break it down pretty simple for you. And I like kind of the green light, yellow light, red light approach. So when you think of a green light, you're going to keep cruising forward. These are easy cases. These are a slam dunk. You're going to scan the patient. You're going to order all, the trays that you need. These are relapse cases, simple class 1, a little crowding or spacing, very simple cases. These you should be doing in your office all day long. There's really no reason to send these out. The second group of cases are the yellow light cases. So these might be a little more involved. And what I want to caution you against is when you hear yellow light, that doesn't mean, oh, be careful, you might not want to do it. For me, this maybe is just a little byproduct of Chicago driving. And I've been in Europe, so I'm aware that the driving's a little hectic over there as well. When I see a yellow light, I'm hitting the gas and I'm going right through it. I'm not slowing down. I'm not jamming my brakes. The reason I call these yellow light cases, though, is you should know going in, these will take a little bit longer. You might have a few more attachments. There might be a little bit more involved with it. Why does that matter? Is we want to be able to prepare our patients. We want to get them in the mindset of, no, we can do this. This will be a great treatment, but it might take you a little bit longer. This might not be an 8-aligner or 10-aligner case. This might be 18 to 25, and that's okay. But the treatment is still going to be the same. On our end as providers, it's still going to be a very similar process and workflow. Now we get to cases like this. This is a whole different animal. And these are cases I don't like to take on. I'm a general dentist. I don't need to do every single case. So these are cases where there's very severe crowding, spacing, things like that. A lot of overbite or overjet. If you're thinking about using elastics, those are things, let the orthodontist fool around with those. These are cases that take 1.5 to 2 years. I don't want to do that. I don't want to be in that treatment that long, nor do my patients. And if they are, they get basically aligner exhaustion, especially adults. So with kids, we put them in brackets and wires. They can't do anything about it. They're tied in. There's no way for them to pop them off unless mom or dad are going to grab the pliers and start knocking brackets off. So with aligners, we want to make sure it's efficient and predictable so our patients complete treatment properly. And then finally, don't touch these. I want nothing to do with these. I don't even entertain the conversation. These are ones where we look at them and we say, you know what? It's time for you to go see an orthodontist. Or they are aware they need surgery and things like that. They're not really interested. A lot of these patients are aware already of their condition. So why do I bring all that up? The green light, yellow light, red light. When you look at the clear aligner guide that SureSmile puts together, when you really think about it, there are a ton of cases that fall into the green light because I lump green and yellow together. As I said, any user should be able to knock out green and yellow pretty predictably. So what that means is when these patients walk through your door, the majority of orthodontic patients in your practice are very doable for you. And when you realize that every day, if you start to look around over the next few days when you're in your clinics, look around. I'll bet every day there's at least 5 patients that could benefit from orthodontics. Do they all want it? Do they all need to have it? No. But when you look around, you're going to see things because hopefully you start to look at things a little bit differently. So when we go through the process, I use the CEREC Prime Scan. Big fan. To me, it's the best scanner out there. Lots of great scanners. The SureSmile system can accept scans from any scanner that can produce an STL, which is pretty much all of them. But what I like about the workflow with the Dentsply Sirona system is that I'm able to take my scans and go in and just upload them right from CEREC, okay, and upload it into the SureSmile software just by pointing and clicking a few times. So I'll show you this is in real time. This will take roughly 30 seconds for this to upload. And so the nice thing is you have the patient, they're engaged, we scan them. Our scans take 2 minutes, 3 minutes tops. Because the scanner is so robust and so quick, anyone in my office is able to scan. So if I have a patient who's coming from my hygienist chair and they're interested, we roll the scanner and scan them in a couple minutes. We get all of our photos and now we're uploading it. And so that's uploaded within minutes to SureSmile. And the nice thing is, once we do that, all of the patient information has now been submitted. And so from here, we're going to go forward and we're going to take all of our pictures. And so we have our series of photos. And this, I don't know if there's any Brady Bunch fans in the room, but this always makes me think of the Brady Bunch and Alice in the middle. But we take our pictures and now we have all the information we need in order to at least start the process of reviewing a case. So if you've used the CEREC workflow at all, you're pretty familiar with kind of the left to right roll through the screen. Well, because I uploaded from my scanner, the first couple spots, when we look up at the top, the patient info and the scan data are already in there. So my patient name, patient date of birth, and ID are all in the software. As I move forward, I get in and now I upload my photos and they all get dropped right into the software. So everything is drag and drop. It's very easy, very Windows-based, things we're all very comfortable with. And we're going to have to just go down the line and we have to make sure each box turns green before we're able to move forward. After that, we get into our exam screen. So very basic. This is how we can communicate with our technicians exactly what's going on. And so we get to tell them which teeth we maybe are going to extract throughout the process. Okay, so that way they could plan and we can allow for Pontics to be made. You're going to let them know if there's any fixed teeth that have implants that they can't move, or if there's a 3-unit bridge, or if there's any teeth that are missing. So we want to make sure this is basically us building a dental chart for our technicians so they are seeing exactly what we are seeing. Okay, this is not done by some generic computer algorithm. There are actually live technicians that are on the other end planning these cases out. And so you're going to have your photos and your x-ray available to you so you can go back and forth. Once you do all that, you're going to go into your prescription. Okay, and the prescription is pretty simple and straightforward, but you can make it as detailed as you want. Now, some of these you may have settings that you've put in that you want to plan for every case. If you're someone who's only treating the social 6 all the time, the top 6 and bottom 6, you might just plan for premolar to premolar or canine to canine, or you could plan for full arch cases. You're going to let them know, do I want to allow you to put attachments or not? Do I want to allow for IPR? So some providers don't like to have any IPR allowed, and they want to just focus on a lot of expansion. And then do I want to allow for elastics? This is one that I generally leave off because then I can communicate with my tech and they say, the only way to get there is with elastics. I know that might not be a case that I personally want to tackle. Then there's a bunch more settings you can put in there, okay? And this can either be just check a box or you can modify as needed. So when we look at it, the midline, do we want to maintain it or correct it? Some of this depends on what your restorative plan is for afterwards. The arch form, maintain, expand, constrict. Overjet. This is really important. If I'm thinking that eventually I'm going to put restorations, I may plan to leave a gap. And I can tell them how much space I want to leave so I have room, because then I can do less reduction of tooth structure. Especially if you think about patients with like acid erosion and things like that, we might not want to have to reduce the teeth very much. So I can plan in my orthodontic software to leave extra room. And the same is true with overbite. And then finally, you can put in special notes. So if there's something unique about a case, you have that patient who says, I want to straighten everything, but I've had a space between my front teeth since I was 4 years old or 7 years old or whatever it might be. They don't want to lose it. That's okay. You could plan that in your treatment. So very customizable. Once we're gone through that whole process, we hit place order. And here's the cool thing. in 24 to 48 hours, you're going to get a workup done. So let's take you through a case. Let's take you through one like this. So here's a great case that kind of is similar to that one I showed from the hygienist chair earlier. The young dentist might say, you know what, I'm just going to go in. That patient hates their crown. I could put a new crown and make it look better. Or I could do 2 crowns and make it look better. Or a veneer and a crown, whatever it might be. When we look from the occlusal, we see a lot of issues here. And so this is where patient education becomes so important, because we can show that patient, well, your tooth is squeezed out of position. I could put 100 new crowns on there, and the only way to line it up would be to make it really, really skinny, which will look dumb, or to leave it in the same position. It could be the same width, but it's not really going to be where you want it. So once you've submitted all of your records for that patient, in 24 to 48 hours, you're going to get something like this. And it's going to be a nice, clean, clear model. It's going to show you where you might want to add attachments, where you might have to do a little bit of IPR to move teeth into a better position. Okay. And at this point, this has been done by a person with a lot of orthodontic experience, and that is your tech that you can communicate back and forth with. So with other aligner systems, one thing I've noticed is that when you go in, they'll plan sometimes for movements that aren't realistic. Whereas with SureSmile, because there's a person on there, they may say, you're not going to be able to spin that canine 180 degrees. So let's not act like we can. Let's have it be more predictable. And that's why you end up with less refinements. At the bottom, there's a little bar. It tells you how many trays. It tells you when you put the attachments on and when you do your IPR. You also get a very detailed breakdown for those of you that like to get in the weeds a little more of exactly how much movement is happening and when it's happening. And so that's pretty helpful for you to understand at what stages you have to really keep an eye on harder movements. You may want to have the patient in around that time to make sure the teeth can slide by each other, that the contacts aren't too tight, or maybe you need a little IPR in that area. So because it's broken down step by step, you can plan your treatment accordingly. And then you have the ability to superimpose their teeth on their face, and you can make them more or less translucent so you can get a visual. So the picture with the retracted smile is really important, so the software can overlay the teeth. And there's about 30 other things that you can toggle on and off, but the software is very robust. The early versions of the software were pretty clunky. Dentsply Sirona and SureSmile, they'll admit it. It was pretty raw. And so we've had to build it up over time. But once now you get in there, this to me is the sweet spot for the patient. This is the home run, right? They come in, or we can send this to them, and we show them video of their teeth moving over time. And nothing is more powerful for patients than seeing their actual teeth move into a better position. So we have this little video animation that we can turn on and off that allows the patients to see how the teeth are going to move. And I always get a kick out of it because you could fool around with the speed and make it slower or faster. So you'll see as we go in, I generally leave it at this pace right in the middle so they can kind of casually see their teeth move. And at the end, I usually will joke with them and say, well, for some patients, we slow it down if they're not paying. And if you pay an extra $1,000, we can go hyperspeed trays and you'll be done in about 2 weeks. So, try to make it a little fun for them. They're excited about it. You want to keep them excited. But because all this happens within about 48 hours of them being in your office, they're still motivated and excited. Think about that impulse buy of the candy bar at the store or Amazon or our phones. People want it when they want it. Okay. So this case ended up with 13 upper trays and 18 lower trays. Now here's my biggest disappointment here is she was supposed to be done with her trays about 2 weeks ago so I could restore that front tooth and at least get her into a temporary. But she had a family thing come up. So she got delayed about 3 or 4 weeks. So she was in, but she's only in aligner 11 at this point. We were hoping to be a little further along so I could have the final for you guys today. But this is her after tray 11. So here's tray 11 right there. You see all the movement. There it is on the lower. And look at the difference. So you tell me which case is going to be easier to get her a nice aesthetic outcome. We've adjusted the angulation of the tooth. We've got it back into the arch form. And now we're able to have the right symmetry. So now all we really have to do is replace that one restoration, and this patient's going to be really happy. Right? Another case that comes up is you have a tooth like this one, number 8. I guess it's 1-1 in FDI numbering. So that tooth is shot. It has to come out. And so the plan is going to be to eventually place an implant. And so we talked to the patient. She has a deep bite. There wasn't really room for a restoration. So we talked about our options. So if you remember, I said you could tell the software what tooth is going to be extracted so they can leave room for a Pontic. So that's exactly what we did here. We had this case. Okay, we ordered the case. We told the software we're going to be extracting this tooth and grafting and doing an implant, but we want to start our orthodontic treatment. This tooth has had endo, so we leveled it and sealed off the chamber and allowed her to start her orthodontics. Well, now in the software, we're able to build in a Pontic, which the patient's able to wear as she goes about her regular life during treatment. This allows me to start my orthodontics before I send her to the surgeon who's going to extract, graft, and do the implant as we move along. All right, a few more straightforward cases. So here was one of my first SureSmile cases. Patient came in, she was getting married. She didn't like that she had some relapse from her early orthodontic cases. Now her wedding was in a few months. We talked about options. We talked about cost. She obviously had a wedding to take care of, so she didn't want to do anything too crazy. So when we look at her, not bad overall, just a little bit of tipping and rotation that needs to be done to get her into a better position. So we took our digital scans and got our workup done, right? And so once we did that, we saw this is the older version of the software. As I mentioned, this was one of my first cases, but there's the before and the after. And you can kind of see as you toggle between them, how the software just gives you the movements and the occlusion afterwards. And this is her with her trays in, very aesthetic, no attachments required, pretty limited treatment. And for her, it was only going to be 5 aligners. So I wanted to find an economical way to get her the solution she needed. Okay. So with only 5 aligners, we were able to pay per aligner. It was very inexpensive. And this was going to be her final result for a wedding. It took us, less than 10 weeks to get this done. And there's her after. So again, moving the teeth around versus going in and grabbing the handpiece and doing anything. All right. A little bit more involved case, nothing too bad. He didn't like his bonding on his front tooth, and he had some crowding. There's a patient who had orthodontics when he was younger. Okay, another classic case that we see in our offices every day. Why shouldn't we help these people? They're looking for it. We're in a perfect position to help them out. The fun thing about this patient, if you look at the photos, I had a hard time getting photos. He has trouble with the mirrors in there with opening. And so it's interesting that I had trouble with photos, but the prime scan was so powerful that I was able to get these nice clean scans of his upper and lower, including that massive extra outgrowth on his upper left molar. So this patient comes in, here he is in aligner 9. So we talk about the aesthetics and the tracking. That's what you're looking for. When they're going through treatment, are those trays fitting perfectly? In his case, they're continuing to track exactly as we hoped they would. And so there he is, 14 aligners, very predictable. Treatment goes as planned. We clean up his bonding at the end, and we have a happy patient on our hands. We're able to get things into a better position and get him the results he's looking for. So when we talk about orthodontics as full mouth reconstruction of enamel, this is a case I think of, but there's also layers, and you as a group of cosmetic dentists can really identify some of these right when you look at it. But obviously this patient has had some crowding, some issues. She's never had orthodontic care. Wonderful patient, interesting woman in that she's not looking for the Hollywood perfection smile. She wants her teeth in a better position. And I'll show you why that comment matters. So this is definitely more of a yellow light case. This is a little more challenging. We had 38 upper aligners and 27 lower. A lot of rotation of canines, which can be a little challenging. A lot of crowding to resolve. Retroclined upper incisors. So, but here's what I want you to look at. And I think you're all going to identify it right away. We've all seen these cases where patients have worn certain patterns over time based on the malposition of their teeth. And she's no different. And so the cool thing was before we did the case, I showed her this was her before and this was her after. And obviously, I assume most of your eyes are going right to those central incisors, as did mine. And so we talked about it and she said, no, I don't care. She's like, that's cool. That's character. I said, well, I just want you to know, because when we get to the end of treatment, prepare yourself. We might want to do a little bonding, some enameloplasty, something. She said, no, I'm telling you, I'm going to like it. I'm like, all right. So this is her before, and this is her final treatment position. So it's exactly as we planned in the software. The outcome is exactly what we thought when we came to those central incisors. So it was nice to be able to have that conversation. And we got to the end, and she's like, I love it. I said, are you sure there's things we could do? I mean, if you're happy, I'm happy. She said, nope, that's how I want to leave them. She's like, I'm good to go. So we didn't do any other cosmetic work. So listening to our patients is paramount to getting good results. All right. But this is her after. So I'm a pretty impressive change for her. So, I mean, who am I to say that that should be an issue? But it's funny how our eyes, especially as dentists, we're used to saying, well, no, at the end, got to line everything up. It's got to be where we want it. Her image of perfection was different from mine. And so she was very happy to go from here to here. And I can't really blame her, but that was the result we got. All right. One more case I'm going to show here, and this is just integrating a little more technology to get to the final result. So this woman came in and she had had these teeth like this for years. And for 20 years, she's kicked around the idea of treatment. And orthodontists have either told her you have to go with brackets and wires, or if we're going to do a liner, it's going to be 12 to 18 months. And she couldn't bring herself to pull the trigger on it. So we talked about it. I said, well, look, we can get a workup done and see what's involved. And she was really focused on how efficiently can we get through this. So I talked about the V Pro, and I brought this in for this case. And so it's that high frequency vibration. And there are some studies that say you could reduce treatment time by 50%. What does that mean? Well, normally we're looking at 2 weeks per tray. With V Pro, there are some studies that say maybe you could try 1 week per tray in the right cases. So it's not recommended by Dentsply Sirona to go 1 week, but I've done enough of this where I was willing to give it a shot. The patient was really aware. So we went with 12 aligners, 1 week per aligner, using the V Pro for 5 minutes per day. Here she is in aligner 12, tracking as planned. Okay, so 3 months of treatment. So there's a patient who believed it was 12 to 18 months, so she never bothered doing it. Well, here she is after 12 weeks. So in our position as dentists, and especially as cosmetic dentists, our job is to rebuild smiles. This patient was discouraged about orthodontics and believed she either was going to have to grind down a bunch of her teeth or commit to 12 to 18 months of orthodontic treatment. And we were able to take her from there to there in just 12 weeks. So the power of the technology in the trays and using some of the ancillary devices really allowed us to get to the finish line. So when I kind of circle back to it all, what is SureSmile's core belief, right? Technology, intelligently applied, allows us to deliver the best care possible to our patients. And that's what I think we have to get back to when we think about clear aligners and orthodontics. And what the SureSmile system does is they're using that technology and they're building it into these trays. This isn't just a fly-by-night type of system. This is one where we can get the results we're looking for our patients. Anything we can do with the digital workflow, to me, just changes the entire experience. It changes the predictability. It takes a lot of human error out. For patients, it's a fun factor, right? They see you take those digital scans. I've yet to have a patient say, I'd rather you took it with the old PVS material, the goop, and had me choking on it halfway through the procedure, right? When they see us do the digital workup and they see their teeth move into a better position, they understand. And then we see the way the trays fit and track. That really brings it all home for us. The last thing I'll say about it is this quote from the movie Ferris Bueller's Day Off, right? Life moves pretty fast. If you don't stop and look around in a while, you could miss it. What does that mean? I live my whole life this way. This has to be fun. Dentistry's really hard. I mentioned it at the beginning. You're all very well aware of it. The last couple of years has probably been harder than ever. So I want to enjoy what I do. I want to see my patients get the treatment they're looking for and be excited and get the results that they want. And the way that we do that is by offering these options in our office and helping them get to where they want to go, helping them say yes. So with that, this is me. For the first time ever, I deep fried a turkey for Thanksgiving here. And I'd never done it before. And it was one of the most amazing foods I've ever eaten. So even better, my neighbor set up all the oil in their driveway. So I didn't even have to have the mess. I got to show up with a turkey, drink their wine, and deep fry it. And it was honestly outstanding. If you haven't tried it, I'd recommend it. But with that, my email's on here. If you ever have any questions or need anything, I hope you enjoyed it. I want to thank Alina and ESCD for having me out. I want to thank Dentsply Sirona for bringing me around, and hopefully it gets you excited about clear aligners and what it can do for you.
Thank you very much, Anthony. Great cases, and it's so easy to